Okay, welcome again to our another topic for our psychiatric nursing at ngayon naman ang pag-usapan po natin ay eating disorders. But before we end our discussions, kailangan matutunan ninyo may-compare and contrast the symptoms of anorexia nervosa and bulimia nervosa. And number two, the various etiologic theories of eating disorder. Also, we need to identify the effective treatment for clients with eating disorder, and also we need to apply the nursing process of the care of our clients with eating disorder, and then what can we provide teaching to our clients, families, and community member to increase the knowledge and understanding about the eating disorder. And lastly, kailangan natin evaluate yung ating feelings, beliefs, and attitudes about the clients with eating disorders. So, alam naman natin when we say eating is a part of our everyday life. It is necessary for survival, but it also a social activity and part of many happy occasions. So, people go out for dinner, invite friends and family for meals in their homes, and celebrate special events such as marriage, holidays, and birthdays with food. But then, for some people, eating is a source of worry and anxiety. So, are they eating too much? Do they look fat? Is weight loss promotions going to be answered? So, obesity has been identified as a major health problem in the United States. Some call it epidemic. So the number of obesity-related illnesses among children has increased dramatically. At the same time, millions of people also, predominantly especially the women, are either starving themselves or engaging in chaotic eating patterns that lead can to deaths. Okay, let's start with the definitions of the eating disorder. So, sa eating disorder can be viewed on continuum with the client with anorexia, eating too little or starving themselves. So, clients with bulimia naman, eating chaotically. And client with obesity naman, that is eating too much. So, yun yung definitions natin. Sa anorexia, that is eating too little. Bulimia, that is eating chaotically, and lastly we have the obesity, that is eating too much. Okay, so yan yung sinasabi niya in terms of the eating disorder. But then let's start with the categories. So pag-usapan natin yung unang kategorya natin, which is the anorexia nervosa. When we say anorexia nervosa, that is a life-threatening eating disorder that is characterized by our clients, restrictions of nutritional intake necessary to maintain minimally normal body weight. So, intense of fear gaining weight or becoming fat. So, significantly disturbed perception of shape or size of the body, and steadfast inability or refusal to acknowledge the seriousness of the problem or even the one exists. So kapag sanabi nating anorexia nervosa, ito yung mga nagre-restricting subtypes or binge eating and purging subtypes. So ano yung sinasabi natin na yon? So, clients with anorexia nervosa can be classified into two subgroups and how they control their weight. So, ito yung mga anorexia nervosa, ito yung mga ayaw tumaba. So, may mini-maintain sila. So, clients with the restricting subtypes lose weight primarily through the dieting, fasting, or excessive exercising. So, those with the binge eating naman and purging subtypes engage regularly in binge eating followed by purging. So, pag sanabi nating binge eating, that is consuming a large amount of food. Okay. In a discrete period, usually 2 hours or less. Pag sinabi naman nating purging, that is involves compensatory behavior designed to eliminate food by means of self-induced vomiting or misuse of laxatives, enemas, and diuretics. So some clients with anorexia do not binge but still engage in purging behavior after ingesting small amount of food. So yon. So yung clients with anorexia nervosa or anorexia becomes totally absorbed in their quest for weight loss and thinness. So the term anorexia is actually a misnomer. So these clients do not lose their appetites. So they still experience hunger but ignore it, and uh, also ignore the signs of physical weakness and fatigue. They often believe if they are eating anything, they will not be able to stop eating and they will become fat. So clients with anorexias are often preoccupied with the food-related activities such as grocery, shopping, collecting receipts or cookbooks, counting calories, creating fat-free meals, and cooking family meals. So they may also engage in unusual or ritualistic food behaviors such as refusing to eat around others, cutting food into the minutes pieces, or not allowed the food they eat to touch their lips. So their behaviors increase their sense of control. So excessive exercise is common and it may occupy several hours a day. So that is for anorexia nervosa. So ang palagi lang natin tatandaan mga anak in anorexia nervosa, ito yung ayaw nilang tumaba. So, meron siyang two subtypes which is the binge eating and then the purging. Next, punta naman tayo sa bulimia nervosa. In bulimia nervosa, often simply called bulimia, is an eating disorder characterized by recurrent episode of binge eating followed by inappropriate compensatory behavior to avoid weight gain, such as purging, fasting, or excessively exercising. So the amount of food consumed during a binge eating is much larger than a person's would normally eat. So our clients often to engage in binge eating secretly. So between binge, the clients may eat low-calorie foods or fast. Uh, Binging or purging episodes are often precipitated by strong emotions and followed by guilt, remorse, shame, or self-contempt. So, the weight of our clients with bulimia is usually in the normal range. Truth, some clients are overweight or underweight. So, there is a recurrent vomiting, destroy our tooth enamel, and incidence of dental caries and raj or chipped teeth increases in this client. So, dentists are often the first healthcare professionals to identify with bulimia. And now we have the related disorders for our eating disorder also. We have the binge eating disorder. We have the night eating syndrome. We have pica and ruminations. And we have orthorexia nervosa. So binge eating disorder is characterized by recurrent episode of binge eating. So there is no regular use of inappropriate compensatory behavior such as purging or excessive exercises or abuse of laxative. So there is a guilt, shame, and disgust about eating behavior and marked psychological distress. So yung binge eating disorder natin are frequently affects people over the age of 35 and it occurs more often in men thus any other eating disorder. So individuals are most likely or more likely to overweight or obese. Overweight as children and tease about their weight at the early age. Okay, so that is for binge eating disorder. In night eating syndromes that is characterized by morning anorexia. So there is evening hyperphagia. So yung evening hyperphagia natin na sinasabi that is consuming about 50% of daily calories after the last evening meal. So there is a nighttime awakeness. So at least once a night to consume a snack. It is associated with life stress, low self-esteem, anxiety, depressions, and there is adverse reactions to weight loss. So that is for our night eating syndromes. So most people in the night are eating syndromes are obese. So the treatment with selective serotonin reuptake inhibitor or yung tinatawag nating SSRI antidepressants has shown limited yet positive effects. Okay. Uh, Eating of or feeding disorder in childhood include the PICA, which is a persistent ingestions of non-food substance, and ruminations or yung repeated regurgitations of food that is then rechewed, reswallowed, or spit out. So both of these disorders are more common in persons with intellectual disability. So yung ating pica and ruminations, and orthorexia nervosa naman, sometimes called orthorexia, is an obsession with proper or helpful eating. Okay, so yun. So, yun yung ating related disorder in terms of eating disorder. Okay, punta tayo sa etiology. So, there are a specific cause for eating disorder is unknown. So, initially, dieting may be stimulus that leads to their development. So, nagkakaroon ng biologic vulnerability, development problems, and family and social influences can turn dieting into the eating disorder. So there is a psychological and physiological reinforcement of the maladaptive eating behavior sustain the cycle. So pag-usapan natin yung ating biologic factors. In the biologic factors, the studies about the anorexia nervosa and then the Bulimia Nervosa have shown that this disorder tend to run in the families. So there is a genetic vulnerability. Okay? So might also result for a particular personality type of general susceptibility to psychiatric disorder. Or it may directly involve the dysfunctions of our hypothalamus. So a family history of mood or anxiety disorder place a person at risk for our eating disorder. The number two, we have the disruptions in the nuclei in the hypothalamus relating to hunger and uh, satiety. That is satisfactions of appetite. That is satiety. Okay, that is satisfactions of appetite. So the lateral hypothalamus and the remedial hypothalamus, deficit in the lateral hypothalamus results in decreased eating and decreased response to sensory stimuli that are important for eating. So nagkakaroon siya ng disruptions of our ventroremedial hypothalamus that leads to excessive eating, weight gain, and decreased responsiveness to the satiety effect of the glucose, which are behaviors seen in bulimia. And then we have also the neurochemical or the norepinephrine or serotonin, not known if these changes cause the disorder or result of eating disorder. So many of the neurochemicals changes accompany eating disorder, but it is difficult to tell whether they cause or result from eating disorder and characteristic symptoms of starvations, binging, and purging. So, for example, our norepinephrine levels rise normally in response to eating. So, kung nagkakaroon ng response to eating, allowing our body to metabolize and use nutrients. So our norepinephrine levels do not rise during starvation. So however, because few nutrients are available to metabolize, therefore, our low norepinephrine levels are seen in clients during the periods of the restricted food intake, and also low epinephrine levels are related to the decrease of our heart rates and blood pressure seen in the clients with anorexia. So also there is an increase of the levels of our neurotransmitter serotonin and its precursor, the tryptophan, have been linked with the increased satiety. Okay? Next one, punta naman tayo sa development factors. There is a two essential tasks of adolescent are struggle to develop autonomy and establish of a unique identity. So, autonomy or exerting control over oneself and the environment may difficult in the families that are overprotective in which nagkakaroon ng enmeshment. Pag sinabi natin enmeshment, that is a lack of clear role boundaries. So these family environments may have orientations towards the control, system maintenance, or conflict. Okay, so yon. It is important to identify the potential risk factors for developing the eating disorder so that prevention programs can target those at the higher risk. So nagkakaroon tayo ng adolescent girls who expresses body dissatisfactions are more likely to experience adverse outcomes. So nagkakaroon tayo ng emotional eating, binge eating, abnormal attitudes about eating and weight. Nagkakaroon din tayo ng low self-esteem, stress, and depression. So yun, nagkakaroon tayo ng problem doon. And then we have also the body image disturbance. So in advertisement, magazine, televisions, and movies that feature teen models reinforce the cultural belief that slimness is attractive. So kapag ganon, excessive dieting and weight loss may be the way of our adolescent chooses to achieve the ideal. Pag sinabi natin kasing body image, that is a low how a person perceive his or her body, that is a mental self-image. So kapag sinabi naman natin body disturbance or body image disturbance, that is occurs when there is an extreme discrepancy between one's body image and the perception of others, and extreme dissatisfactions with one's image. Okay, so that is for our development factors. There is a struggle for autonomy, identity, overprotective, or enmeshed family. Pag sinabi natin enmeshment, that is the lack of clear role boundaries. Okay, we have the body image disturbance, which is our body and body image, and then lastly we have the self-perceptions of the body. Punta naman tayo sa family influences. In the family influences, there is a family dysfunctions and childhood adversity. So, for example, the girls growing up amid family problems and abuse are at the higher risk for both anorexia and bulimia. So there is a disordered eating is a common response to uh, family discord. So girls growing up in a families without emotional support may try to escape their negative emotions. They may place in an intense focus outward or something concrete. So there is a physical appearance. Disordered become a distractions from emotions. So childhood adversity has been identified as a significant risk factor in development of problems with eating or weight in adolescent in early adulthood. So adversity is defined as a physical neglect, sexual abuse, or parental maltreatment that includes little care, affections, and empathy, as well as excessive paternal control, unfriendliness, or overprotectiveness. Okay. Punta naman tayo sa uh, sociocultural factors. In the sociocultural factors, there is a media or pressure from others. So, di ba? Yung media, this culture equates beauty, desirability, and ultimate happiness with being a teen, tone, and physical fit. So, adolescents often idealize actresses and models having a perfect look or body. Okay? So, yon. And then, pressure from others may also contribute to the eating disorder. So, pressure from coaches, parents, and peers, the emphasis placed on the body form in sports such as gymnastics, ballet, and wrestling can promote eating disorder for our athletes. So, yun. Okay, let's proceed to the cultural considerations. In cultural considerations, both anorexia nervosa and bulimia nervosa are far more prevalent in industrialized societies where food is abundant and beauty is linked with thinness. Okay, so in the United States, anorexia nervosa is less frequent among African Americans. On the islands of Fiji, when there was little televisions, eating disorders were almost non-existent, and being plump was considered the ideal shape for girls and women. So, yun. Eating disorder are most common in the United States, Canada, Europe, Australia, Japan, New Zealand, South Africa, and other developing industrialized countries. So as society become more prosperous with increased availability of food that is high in fat and carbohydrates, that increase the emphasis on thinness equals beauty concepts, and the immigrants from culture in which eating disorder are rare may also develop the eating disorder, so as they assimilate the thin body ideal. So, yon. Questions. Is the following statement true or false? So, one current biologic theory about eating disorder is that it involves disruptions in the cerebral portions of the brain. The answer is false. So, ang rationale natin doon, one of the biologic theories of eating disorder involves the disruptions of the nuclei in the hypothalamus that relates to hunger and satiety. Okay? Okay, punta na tayo sa anorexia nervosa. So, titignan natin, the onset is usually between the ages of 14 to 18 years of age. So, they're in early stage, clients often deny having a negative body image or anxiety regarding their appearance. So they are pleased with their ability to control their weight and may express this. When they initially come for treatment, they may be unable to identify or explains their emotions. So as the illness progresses, depressions and lability in mood become more apparent. So as dieting and compulsive behavior increases, a client isolate themselves. So these social isolations can lead to basic mistrust of others and even paranoia. So client may believe their fears are jealous of their weight loss and may believe that the family and healthcare professional are trying to make them fat and ugly. Okay, so the treatment for our anorexia nervosa, client with anorexia nervosa can be difficult to treat because they are often of resistance, appear uninterested, and deny their problems. So the treatment settings include inpatients, specialty eating disorder units, partial hospitalizations, or day treatment programs and outpatients therapy. So the choice of setting depends on the severity of the illness, such as weight loss, physical symptoms, durations of being or purging, drive for fitness or body dysfunctions, and comorbid psychiatric conditions. So, yun. So, yung pwede natin gawin na treatment for our anorexia nervosa. Next, our medical management. So medical management focuses on the weight restorations, nutritional rehabilitations, rehydrations, and corrections of the electrolyte imbalance. So clients receive nutritionally imbalanced meals and snack that gradually increases the calorie intake to a normal level for size, age, and activity. So there is a severely malnutrition clients may require total parenteral nutrition, tube feeding, or hyper alimentations to receive adequate nutritional intakes. So yun yung pwede natin gawin for the medical management for the kwan. So, ang isipin lang natin, the weight restoration and nutritional rehabilitations, and then rehydrations, correction of the electrolyte imbalance. Let's proceed to the psychopharmacology. So, ang drug of choice. So, several classes of drugs have been studied but few have shown clinical success. So, isa doon is amitriptyline or Elavil. And then the antihistamine, cyproheptadine is the high dose can promote weight gain in patient with anorexia nervosa. Okay? So, pwede yun. So, amitriptyline and then cyproheptadine. So, ito yung nagpo-promote ng weight gain sa ating inpatients with nervosa anorexia. So, meron din tayong olanzapine and fluoxetine na ginagamit has used to success because of its antipsychotic effect and associated with weight gain. Okay, so that is olanzapine. While in the fluoxetine, that is some effectiveness in preventing relapse in a clients whose weight gain or weight has been partially or completely restored. Okay? Punta naman tayo sa psychotherapy natin. We have the family therapy, individual therapy, and then we have the CBT. In family therapy may be beneficial for families of clients younger than 18 years. So, family who demonstrate enmeshment, unclear boundaries and among members, and difficulty handling emotions and conflict can begin to resolve these issues and improve their communication. So there is a family therapy is also used to help the member to be effective participant to prevent the future exacerbations of anorexia when families are able to participate in a effective manner. While in the individual therapy for clients with anorexia nervosa may be indicated in some circumstances. So for example, if the family cannot participate in the family therapy, if the client is older or separated from the nuclear family, or if the client has individual issues requiring the psychotherapy. So the therapy that focuses on the client's particular issues and circumstances such as the coping skills, the self-esteem, self-acceptance, interpersonal relationship, and assertiveness can improve the overall functioning and life satisfactions. Punta naman tayo sa CBT. CBT is a long use with the clients with bulimia, has been adapted for adolescents with anorexia nervosa, and used successfully for initial treatment as well as relapse preventions. Pag sinabi natin kasing CBT, that is the cognitive behavioral therapy. Okay? Next one, let's proceed to the bulimia nervosa. So, bulimia nervosa is usually begins the late adolescence or early adulthood, 18 or 19 years in the typical age of onset. So, binge eating frequently begins during or after the dieting. So, between eating frequently begins during or after dieting. So, between binging or purging episodes, client may eat restrictively, choosing salads and other low-calorie foods. So there is a restrictive eating effectively set them up for the next episodes or binging or uh, purging, and the cycles continue. So clients with bulimia are aware that their eating behavior is pathologic and they go great lengths to hide it from others. So nagtatago sila kapag sila ay kumakain. They may store food in their cars, desks, or secret locations around the house. So they may drive from one fast food restaurant to another, or ordering a normal amount of food at each but stopping at 6 places in 1 or 2 hours. So, yan yung ating uh, bulimia nervosa. So, ang treatment lang natin dyan, we have the CBT or cognitive behavioral therapy is the most effective treatment for our bulimia. So, yun yung pwede nating gawin. And then the psychopharmacology natin, that is the antidepressants. So yun yung pwede nating igamot sa ating mga pasyente. Okay? So which of the following is typically age onset of anorexia? A, 10 to 14, B, 14 to 18, C, 18 to 22, or D, 22 years and older. So the answer is letter B, that is 14 to 18 years. So ang rationale natin doon, most commonly, anorexia begins between the ages of 14 to 18 years. Okay, so punta na tayo sa ating eating disorder and nursing process. So yung assessment natin, the applications of the nursing process, although anorexia and bulimia have several differences, but many similarities are found in assessing, planning, implementing, and evaluating nursing care for clients with this disorder. Okay? So, yun. Okay. In the assessments, there is a history. Pag sa anorexia nervosa or anorexia, ang history natin, titingnan natin palagi is the perfectionist or eager to please. Okay. And while in bulimia, the history of impulsive behavior. So, yun yung titingnan natin. So, family members often describe clients with anorexia nervosa are perfectionists with above average intelligence who are achievement-oriented, dependable, eager to please, seeking approval before onset of the condition. So, parent describe clients being good, causing us no trouble. So, until the onset of anorexia. So, clients naman with bulimia, sabi ko nga kanina, that is a history of impulsive behavior, such as substance abuse, shoplifting, as well as anxiety, depressions, and personality disorder. Punta naman tayo sa kanilang general appearance and motor behavior. In anorexia nervosa, that is slow, lethargic, and emaciated. While in bulimia, that is generally close to expected weight for the size. Okay. So, yun yung makikita natin. So, clients with anorexia nervosa appear slow, lethargic, fatigued. They may be emaciated depending on the amount of weight loss. They may be slow to respond to the questions and have difficulty deciding what to say. They are often reluctant to answer questions fully because they do not have the knowledge of any problems. They often wear loose-fitting clothes in layers, regardless whether both to hide weight loss and to keep warm. So eye contact may be limited. Clients may turn away from the nurse, indicating their unwillingness to discuss problems or the treatment. While in clients with bulimia may be underweight or overweight, but generally close to expected body weight for age and size. So yung general appearance na is not usual and they may appear open and willing to talk. Punta naman tayo sa mood and affects. Clients with eating disorder has a labile modes that usually corresponds to their eating or dieting behavior. Avoiding bad or fattening foods give them a sense of power and control over their body. So, while eating, uh, being or purging leads to anxiety, depressions, and feeling out of control. So, yung clients natin with eating disorder often seem to be sad, anxious, and worried. Those with anorexia seldom smile, laugh, or enjoy attempts at humor. They are sober and serious most of the time. So, yun yung ating mood and level of our eating disorder. Okay? Punta naman tayo sa kanilang thought process and content. So usually yung ating clients with eating disorder is spend most of the time thinking about dieting, food and food related behavior. They are preoccupied with their attempts to avoid eating or eating bad or wrong food. So our clients cannot think about themselves without thinking about their weight and their food. So nagkakaroon siya ng body image disturbance, can almost delusional. Okay. Sensorium and intellectual process. In the sensorium and intellectual processes, generally, clients with eating disorder are alert and oriented, so their intellectual functions are intact. The exceptions is clients with anorexia who are severely malnourished and showing signs of starvation, such as mild confusion, slowed mental processes, and difficulty with concentrations and attentions. Next one, we have the judgment and insight. In client with anorexia nervosa, or have a limited insight and poor judgment about their health status. They do not believe they have a problem. Rather, they believe others are trying to interfere with their ability to lose weight and to achieve the desired body weight. So, facts about failing health status are not enough to convince our clients of their true problems. So, clients with anorexia continue to restrict foods intake or to engage in purging despite in the negative effect on the health. In contrast, clients with bulimia are ashamed of binge eating and purging. So they recognize this behavior as abnormal and go to great lengths to hide them. They feel out of control and unable to change, even so they recognize their behavior as pathologic. In the self-concept, that is the low self-esteem, is a prominent in a clients with eating disorder. So they see themselves only in terms of their ability to control their food intake and weight. They tend to judge themselves harshly and see themselves as bad if they eat certain foods or fail to lose weight. So they overlook or ignore other personal characteristics or achievement as less important than saneness. Okay? In the roles and relationship, eating disorder interfere with the ability to fulfill roles and to have satisfying relationships. So clients with anorexia may begin to fail at school, which in sharp contrast to previously successful academic performance. They withdraw from fears and pay little attentions to friendship. They believe that others will not understand or fear that they will begin out of control. So client with bulimia feel great shame about their binge eating and purging behavior. As the result, they tend to lead secrets, uh, lives that include sneaking or behind the backs of their friends and families to binge and purge in privacy. So there is a time spent buying and eating food, and then purging can interfere with the rule performance both home and at work. Next one, we have the physiological and self-care considerations. So the health status of our client with eating disorder relates directly to the severity of the self-starvations or purging behavior. Okay. So yun yung makikita natin. So in addition, client may exercise excessively, almost to the point of exhaustions in an effort to control the weight. Okay. In the data analysis and nursing diagnosis for clients with eating disorder includes imbalanced nutrition, less than or more than the body requirements, ineffective copying, disturbed body image, chronic low self-esteem. So other nursing diagnoses may be pertinent such as deficient fluid volume, constipations, fatigue, and activity intolerance. In the outcome identification for severely malnourished clients, their medical conditions must be stabilized before psychiatric treatment can begin. Medical stabilization may include parenteral fluids, total parenteral nutrition, and cardiac monitoring. So, example of expected outcome for our clients with eating disorder includes the client will establish the adequate nutritional eating pattern. The client will eliminate use of compensatory behaviors such as excessive exercise and the use of laxative and diuretics. The client will demonstrate coping mechanisms not related to food. The client will verbalize feelings of guilt, anger, anxiety, or an excessive need for control. And lastly, the client will verbalize acceptance of the body image, will stable the body weights. Punta na tayo sa kanilang interventions. So, in interventions, typically, inpatient treatment is for a client with anorexia nervosa who are severely malnourished and for client with bulimia whose binge eating and purging behavior are out of control. So, our primary nursing role are uh, to So the primary nursing roles are to implement and supervise the regimens for our nutritional rehabilitation. So total parenteral nutritions or enteral feedings may be prescribed initially when a client's health status is severely compromised. Okay, so when a client can eat a diet of 1,200 to 1,500 calories per day is ordered. So with the gradual increases in calories until the clients are ingesting adequate amounts for height, activity levels, and the growth needs. So typically, allotted calories are divided into 3 meals and 3 snacks. So a liquid protein supplement is given to replace any food not to eaten to ensure consumptions of the total number of the prescribed calories. So initially, the nurse is responsible for the monitoring of his or her meals and snack and often initially will sit with the client during the eating at a table away from the client. So depending on the treatment program. So there is a diet, beverage, and food substitutions may be prohibited and a specified time may be set of consuming each meal or snack. So clients may also be discouraged from performing food rituals such as cutting of food into tiny pieces or mixing food in a usual combination. So, the nurse must be alert for any attempts by clients to hide or to discard the food. So, ano pang pwede natin? So, dealing also with the body image issues and providing clients and the family education. So, yan yung mga intervention natin na pwede nating gawin sa ating pasyente in terms of eating disorder. So, sabi ko nga, we need to identify the emotions and the coping strategies. So there is a self-monitoring in terms of the bulimia. Kasi because some clients with anorexia problems with self-awareness. So they often have the difficulty identifying and expressing feelings or yung tinatawag nating alexithymia. Therefore, they often express this feeling in terms of somatic complaints such as feeling fat or bloated. So the nurse help clients begin to recognize their emotions and such as anxiety or guilt by asking them how they are feeling and allowing adequate for response. And then self-monitoring is a cognitive behavioral technique designed to help the client with bulimia. It may help the client identify the behavior patterns and then implement techniques to avoid the replace them. So self-monitoring techniques raise client awareness about the behavior and help them regain a sense of control. In providing clients and family education, what is the primary nursing role there is caring for a client with eating disorder is to provide educations to help them control of nutritional requirement independently. And lastly, evaluations. So the nurse can use assessment tools as eating attitude tests to detect the improvement for client with eating disorders. So both anorexia and bulimia are chronic for many clients. So yun yung titignan natin. Okay, so in hospital admissions only for medical necessity. So, treatment for clients with eating disorder usually occurs in the community setting. So, hospital admission is indicated only for medical necessity, such as for clients with dangerously low weight, electrolyte imbalances, or renal, cardiac, or hepatic complications. So, clients who cannot control the cycle of binge eating and purging may be treated briefly in an inpatient setting. So, other treatments setting include partial hospitalizations or day treatment programs, individual or group, outpatient therapy, and self-help group. In our mental health promotions, nurses can educate parents, children, and young people about the strategies to prevent eating disorder. Important aspects include the realizing that the ideal figures portrayed in advertisement and magazine are unrealistic, developing realistic ideas about the body size and shape, resisting peer pressure to diet, improving self-esteem, and learning coping strategies for dealing with emotions and life issues. Healthy People 2020. In Healthy People 2020, that is includes an objective to increase the comprehensive school educations for various variety of topics, including the unhealthy dietary pattern and inadequate physical injury. This is a response to the increasing epidemic of obesity in the United States, including the young children and our adolescents. Okay, the National Eating Disorder Association's guidelines, the following suggestion to promote the body image, promote the positive body image. So get rid of notions that are particularly diet, weight, or body size will automatically lead to happiness and fulfillment. Learn everything you can about anorexia nervosa, bulimia nervosa, binge eating, and other types of eating disorder. Make the choice to challenge the false idea that thinness and weight loss are great and that the body fat and weight gain are horrible or indicate laziness, worthlessness, or immorality rather. Avoid categorizing foods as good or safe versus bad, dangerous. So remember that we are need to eat a balanced variety of foods. So stop judging yourself and other based on the body weight or shape. Turn off the voices in your head that tell you that a person's body weight is indicator of their character, personality, or value as persons. And then limit time on social media. So don't read or listen to others' negative comments and surround yourself with positive, supportive, or real people. Become a critical viewer of the media and its images about self-esteem and body image. Don't accept that the image that you see are the ideals you should try to attain. So choose to value yourself based on your goals, accomplishments, talents, and characters. So avoid letting the way you feel about your body weight and shape determine the course of your day. So meron din tayong screening questions. So sa screening question natin, these are the questions that needs to answer by our clients. Questions. Is the following statement is true or false? Self-monitoring is effective technique that a client with anorexia can use. The answer is false because self-monitoring as effective technique that a client with bulimia can use. Okay, so self-awareness issue lang tayo. In self-awareness, an emaciated, starving client with anorexia can be shocking sight, and the nurse may want to take care of this child and nurse her back to health. When the client rejects this help and resists the nurse's caring actions, the nurse can become angry, frustrated, and feel incompetent in handling the situation. So, the client initially may view the nurse who is responsible for making the client eat as the enemy. So the client may hide or throw away food or become overtly hostile as anxiety about eating increases. So the nurse must remember that the client's behavior is a symptom of anxiety and fear about gaining weight and not personally as symptoms of anxiety. The nurse must remember that client behavior is a symptoms of anxiety and fear about gaining weight and not personally directed towards the nurse. So taking the client's behavior personally may cause the nurse to feel angry and behave in rejecting manner. And then lastly, be empathetic and non-judgmental. Okay, ulitin ko, the points to consider working with the clients with eating disorder. Be empathetic and non-judgmental. So this is not easy. Remember the client's perspective and fears about the weight and eating. Avoid sounding parental when teaching about nutrition or why laxative use is harmful. Presenting information factually without chiding the clients will obtain more positive result. And lastly, do not label clients as good when they avoid purging or eat an entire meal. Otherwise, client will believe they are bad on days when they purge or fail to eat enough food. So that is for our eating disorder. So thank you for listening.